My name is Juanes Prosper. I am from New York City. Part of my life, I grew up living in St. Nicholas housing projects. I am the creative director and CEO of Prosper Digital. We were asked by NYC Smoke-Free, a program of public health solutions, to create a short film about the new smoke-free housing policy.
Let it rain, let it rain, let it rain.
This project also involved working with teens from Brownsville, part of NYCHA's Youth Leadership Council. The goal was to build awareness about the smoke-free housing policy and to provide skills in filmmaking.
Well, the reason I wanted the youth to be involved was, one, to learn about the production side of filmmaking. We have an advocacy campaign, which is beautification in the neighborhood. So I figured, we're doing the smoke-free campaign, that it would be perfect, that it was a great link.
The first iteration of a Smoke-Free Air Act was actually in 1995. And that was when all conventional workspaces, so like your office buildings like this, your municipal buildings, you could no longer smoke in those buildings.
NYC Smoke-Free focuses on tobacco control. We're a program of public health solutions, one of the oldest and largest public health organizations in New York City. The smoke-free housing rule is actually a requirement or a mandate by the Department of Housing and Urban Development, which we call HUD. HUD regulates all public housing authorities across the country. NYCHA is the largest public housing authority in the country. So this is going to not only impact residents of NYCHA in New York City, but across the country, because it will be seen as an example of how other housing authorities can go smoke-free. Before it goes into effect, there were a number of different steps that NYCHA took to involve the community and other stakeholders in this process. NYC Smoke-Free sat on their Smoking and Health Advisory Group. Amongst the public health professionals and tobacco control experts, NYCHA residents were also included to help inform how the policy would be drafted and also implemented over time.
My name is Zachary Rumnick. I'm 16 and I'm from Brooklyn, New York, Brownsville, Van Dyke Houses. In my role, I'm the president of my youth council, Zone 7, Brownsville. Filmmaking is something I would want to do because where I see myself, I want to be a producer. I'm thinking like things I really want to know.
My father grew up in a house full of cigarette smokers, and he had bad asthma growing up, and he had a lung surgery because of it.
I had accomplished to get my father to stop smoking cigarettes at one point. And like my father doesn't smoke cigarettes anymore. It just like we stopped my dad. Now I'm just working on my older brother.
Has smoking impacted your life in any way?
Used to smoke cigarettes. Once I had children, yeah, it affected, I didn't want y'all to have any secondhand smoke or any kind of, effects of smokers. I was actually hoping that this does stop a generation of young children smoking and going to the store to get a Lucy and all these other bad habits that, like I said, they come up watching. We only learn what we watch. If we start watching different, we'll learn different.
I think this will be one of the hardest rules to follow. I feel like so many people have been smoking in their house for however long, to now you're just putting a stop to it and trying to either punish or give you a consequence. People don't take well to that at all. So I don't see how we're gonna push that forward when there's so much other things happening in Brownsville. This rule seems like it's a way to kick you out. That's the biggest fear. It feels like it's like intimidation to get you out the projects.
My name is Marvin Jean-Jacques. I'm the Health Programs Manager for the Health Initiatives team here at the New York City Housing Authority. Every time I go out talking about smoke-free housing, people will say, NYCHA, you guys have all these other things with maintenance and repairs. Don't you have other priorities? And what I always say is, yeah, we have a lot of priorities, a lot of problems that need to be addressed. And just because we have these problems, there's no way we can say, let's let something like secondhand smoke not be addressed. All of these problems are being worked on. How can we put aside something as important as secondhand smoke exposure?
Zach was able to come with us to interview some of the public health professionals about the effects of secondhand smoke and the importance of smoke-free policies.
Can you explain what your organization does in your role?
Yes. My name is Lisa David. I'm the president and CEO of Public Health Solutions. Public Health Solutions is responsible for the tobacco control work within the communities of New York City. We advocate for smoke-free policies like the HUD rule as often as we can. And as you have seen year after year, there have been new policies that have been put in place that give more and more people access to smoke-free housing. There's documents from the tobacco industry themselves that they target communities. They are looking for communities where they can build new smokers and where they can keep people smoking. We see it in the evidence of the marketing work that they do, and we've seen it in their own documents.
During the interviews, we learned that the tobacco industry is notorious for targeting communities of color. An example of this is the pervasive marketing of menthol cigarettes.
Amongst African Americans who smoke, over 80% of them smoke menthol cigarettes. And that's not by accident. Big tobacco marketed to underserved communities, and the result is African Americans smoking menthol at a much higher rate. It creates this false sensation of safe smoking because of the cooling effect. That is a definite example of a disparity. The numbers are not the same in more affluent communities as they are in underserved communities.
There's no safe level of secondhand smoke. For people that have any kind of respiratory issue like asthma, it's a real trigger. And we know the majority of people in NYCHA don't smoke, and even if you are not right there while somebody's smoking, it travels through the ventilation system, it travels down the hall.
From what I've learned so far, we share 60% of airspace in our units, in NYCHA units. That could affect people. You don't know people's conditions that live over you, under you, or next to you. That might even live down the hall. I say people should really listen and understand or look at the facts.
My name is Tanea Williams. I live in Tilden Projects. I don't smoke, but I have relatives that do. My mother, she smokes. I do think the NYCHA rule will be easier for me and on her, I guess. So, because when she stops, I feel that she will see a great impact on her granddaughter's life. My daughter, Janaya, she has asthma, and because of the smoking, we've been in and out of hospitals. The hospital visits continuously all her life. She had got infected with a respiratory infection, so she had been hospitalized, and she had to get IV because she wasn't eating, she wasn't digesting things, so they had to do all types of x-rays, and she's in pain sometimes. I get emotional, sorry. As a mother, I just hate to see my child in pain, basically. So, that's that.
My mom does smoke, and it has affected her now because now she has asthma and she wheezes in her sleep. Me and my brother are trying to get her to quit.
Yes, smoking has impacted my life in certain ways. I have shortness of breath. It prevents me from doing certain things. The rule is not going to be that hard to enforce, depending on what strategies they have in place, because 25 feet from the building, to me, is basically in the middle of the street. So that means I pay rent here and I have to go out and stand in the middle of the street just to smoke a cigarette. Not good. If they can help me stop smoking, that's a great thing. But I need to know, what are they putting in place for the smokers.
I'm a firm believer that residents are really the experts when it comes to their experience and how things could be rolled out at the development level. First step is to make sure that we address people's concerns with regard to them losing their homes. The answer is no, we're not trying to evict people. And that's also the guidance we got from HUD. It's not about eviction, it's about education. Then the enforcement questions kind of get dealt with. We have 70 community meetings that we'll be doing from January through June and July to let people know about it and get the word out. We have to make sure we talk to residents, partner with them so we can make it happen. No smoking in the public housing units, right? That's in the apartments. So no smoking in the public housing units and outdoor areas within a 25-foot perimeter of the building, residential and administrative. There will be gradual enforcement, and this is something that everybody's been wondering. That's the first question. How are you going to enforce this? What does that look like? HUD recommends that it's graduated, and this is what we're doing. We're going to allow staff and residents to be able to report violations. The reason this is important is because staff are also impacted by this rule. There'll be an informal and formal conferencing in response to violations. That's the first thing is, hey, do you know that NYCHA is now smoke-free? If the person says yes, or if they say no, they continue the conversation. And what we're doing is asking property management to then provide either cessation support or tips for people to comply to the rule.
I know it's going to be hard to enforce this law.
Yeah.
Because we're talking about individuals' apartments and stuff. With the new lease addendum, how are they going to enforce that?
So the lease addendum means that anyone who violates it or violates the rule would actually be violating their lease, right? And so how do we enforce that? Again, it'll be the informal process, which I mentioned before, a conversation with the property manager, and then a formal process. But we're not starting with that because we want to have those conversations about cessation support, about why we have the rule and the rationale first.
I thought it was very informative. I thought it was a lot of good points that they brought out and the rules and regulations that we're going to have to adhere to. And it's about people's health. I smoked, I was younger than what I am now, you know. But I think health-wise, you know, that people need to be more serious and take more consideration as far as your health is concerned, because smoking is an addiction.
Look, it takes many attempts before you can be successful in quitting smoking. I myself, I had to replace it, so I started running. So whatever you could do to help you accomplish that goal, do it, right? And NYCHA's there, we'll do whatever we can to connect you to the experts.
There's a lot of different places that NYCHA residents can go if they want to quit smoking once and for all. Probably the easiest one is to just pick up your phone and dial 311. There are tools that can help smokers quit, things like the gum and the patch. There's counseling available to have people talk about it in a way that's targeted. And those tools combined are all going to help smokers quit.
Many resources I can think of off the top is they should first really go to their healthcare providers. They have a healthcare provider. You should go down to the healthcare provider, sit down and have a talk. Say, listen, I'm looking to quit smoking. How can I actually do that? And your healthcare provider is definitely the first place of contact. Next, you have the New York State Smokers Quit line, which you can reach out to those folks for help as well. That's 1-866-NY-QUITS. People should reach out to them on the New York State Smokers Quit line. There they can provide you with different types of cessation resources.
There's a lot of stuff on the grounds of the development that people can do that'll help. We also have a robust gardening program. So we've got 500 gardens, and we could go to their management office, get an application, apply to form a garden and get a new hobby or something like that that is active, that is outdoors, that can help deal with the stress of quitting smoking.
Smoking is an addiction. So that's physical. That's something you're gonna have to get medical help for, right? Well, we're gonna need medical help then. We're gonna need a lot of medical help because there's a lot of people who are impacted by the smoking.
When I first started this project, I thought there was no way possible that this policy could be implemented. Now, I see firsthand how NYCHA is working with residents and community partners to create a smoke-free environment. When I think about young people like Zach and his peers, I want them to feel empowered and to know that they can use their voices to make a difference.
The ways I can help implementing this rule is actually speaking out to people. Most people just need to be talked to, just need to hear the real side, just need to hear the background to it. And I'll be that person to speak up.
Let